dalam Malaysia Madani. Mohon maaf tadi terdapat sedikit technical error. Yang berusaha Dr. Farida binti Awang, pengarah Institut Sosial Malaysia, yang dihormati dua orang penceramah kita, pembentang kita pada pagi ini, iaitu Dr. Suzanna binti Awang Bono, merupakan pensyarah dari School of Social Science, Universiti Sains Malaysia. Yang kedua adalah Dr. Azahah binti Abu Hassan Shaari dari Fakulti of Social Science and Humanities, Universiti Kebangsaan Malaysia. Dan kepada semua peserta Kolokium Pendidikan Bilangan 5204 yang hari ini bertajuk ataupun bertemakan kesihatan mental. Bersyukur kita kehadrat Allah Subhanahu Wa Taala yang telah memberikan kesihatan dan kelapangan masa untuk kita bersama-sama berkumpul dalam program webinar Kolokium Pendidikan ISM bertemakan kesihatan mental anjuran ISM. Saya, mewakili pengarah, mengucapkan selamat datang ke Institut Sosial Malaysia dan terima kasih kepada tuan-tuan dan puan-puan kerana sudi menerima undangan kami. Untuk maklumat semua peserta, program webinar Kolokium Pendidikan ISM bertemakan kesihatan mental pada hari ini dilaksanakan melalui kaedah atas talian melalui aplikasi Zoom dan penstreaman terus Facebook rasmi ISM. Moto kami ilmu sejahterakan masyarakat ISM. Bagi memberkati majlis pada pagi yang mulia ini, mari bersama-sama merafakkan kesyukuran ke atas rahmat dan limpah kurnia Allah Subhanahu Wa Taala kerana dengan izinnya majlis pada hari ini dapat dijalankan sebagaimana yang telah dirancang. Dengan ini majlis mempersilakan Encik Amirul untuk memimpin bacaan doa. Dengan segala hormatnya dipersilakan.
Assalamualaikum warahmatullahi wabarakatuh. وقال ربكم ادعوني استجب لكم. اعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وأصحابه أجمعين. اللهم اغفر لنا ذنوبنا ولإخواننا الذين سبقونا بالإيمان ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم. Ya Allah, Ya Rahman, Ya Rahim, kami bersyukur di atas segala nikmat yang telah Engkau kurniakan kepada kami. Antara nikmat itu dapat kami menghadiri dan mengikuti Kolokium Penyelidikan Siri 5 2024 yang bertajuk Kesihatan Mental kali ini dengan jayanya. Ya Fattahu Ya Alim, sesungguhnya Engkau Maha mengetahui bahawa kami di sini ingin menimba ilmu-Mu yang sangat luas bagi mengembangkan potensi kami sebagai hamba-Mu yang Engkau redai. Justru berkati dan rahmatilah majlis kami ini, kurniakanlah kepada kami ilmu-Mu, sinarilah hati-hati kami dengan cahaya dan hidayah-Mu. Semoga dengannya kami mudah menerima dan menghayati serta mengamalkannya. Ya Zal Jalali wal Ikram, kurniakanlah kepada kami kesihatan anggota, kecergasan minda, ketenangan jiwa, kekuatan semangat. Semoga dengannya kami mampu mendepani cabaran, berdaya saing dan mampu mengangkat martabat diri, keluarga, organisasi, masyarakat dan negara kami. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا معنا ولا من يتبعنا شقيا ولا مطرودا ولا محروما. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Terima kasih diucapkan kepada Encik Amirul di atas kesudian Encik Amirul untuk memimpin bacaan doa sebentar tadi. Tuan-tuan dan puan-puan yang dihormati, majlis program pada hari ini diteruskan dengan program Kolokium Pendidikan yang bertemakan kesihatan mental. Sebelum itu, izinkan saya memperkenalkan dua panel kita pada pagi ini, iaitu Dr. Suzanna binti Awang Bono yang merupakan pensyarah School of Social Sciences, Universiti Sains Malaysia, dan Dr. Azahah binti Abu Hassan Shaari dari Fakulti of Social Science and Humanity, Universiti Kebangsaan Malaysia. Selamat datang kedua-dua doktor, dan masih belum terlambat lagi doktor untuk saya ucapkan selamat menyambut Hari Raya Aidilfitri. Doktor, izinkan saya untuk membacakan sedikit latar belakang mula daripada Dr. Suzanna. Seperti yang dimaklumkan, Dr. Suzanna merupakan sekarang berkhidmat sebagai pensyarah di School of Social Science, Universiti Sains Malaysia, dan juga merupakan penasihat dari segi Psychological Society di Universiti Sains Malaysia, dan aktif sebagai penasihat Scuba Diving Club Doktor di USM, juga aktif dalam Malaysian Psychological Association bermula pada tahun 2019. Dalam bidang pendidikan, beliau menerima PhD pada tahun 2019 daripada Universiti Cardiff University, Wales, United Kingdom. Dari segi pengalaman, saya memang panjanglah doktor kalau nak baca ni lah. Jadi yang kedua pembentang kita adalah Dr. Azahah binti Abu Hassan Shaari, yang kini berkhidmat sebagai pensyarah di Fakulti Sosial Science and Humanities, Universiti Kebangsaan Malaysia, memperoleh ijazah PhD pada tahun April 2020 dalam bidang yang bagi saya agak menarik jugalah, iaitu PhD dalam Forensic Social Work. Dissertation ini lebih kepada an exploration of the lived experiences of counselors in recovery from substance use disorder working in addiction treatment field in New York, USA. InsyaAllah doktor mungkin boleh apply di Malaysia juga doktor ya. Dan doktor, pada pagi ini saya tidak mahu membuang masa. Kita ada kekangan masa sebab pembentang saya ingin menerangkan flow perjalanan program pada pagi ini. Seperti dimaklumkan, kita ada dua orang pembentang, Dr. Suzanna dan Dr. Azahah. Jadi Dr. Suzanna akan membentangkan kertas penyelidikan beliau bertajuk Threats of Tomorrow, Navigating Youth Wellbeing Through Social Media, Emotional Literacy and Art. Manakala Dr. Azahah binti Abu Hassan akan membentangkan berkaitan Analyzing the Role of Social Workers in Supporting People Living with HIV in New York City during the era of 90s. Jadi di Mefo, Dr. Suzanna akan bentang penyelidikan tulang tempoh setengah jam, dan selepas itu akan ada satu session Q&A daripada para peserta, dan dalam tempoh 15 minit selepas itu, dan diikuti dengan Dr. Azahah yang akan membentangkan berkaitan dengan Analyzing the Role of Social Workers in Supporting People Living with HIV in New York City during the 90s. Tanpa membuang masa, saya menjemput Dr. Suzanna binti Awang Bono untuk membentangkan kertas penyelidikan beliau. Dengan segala hormatnya, saya mempersilakan Dr. Suzanna.
Assalamualaikum dan salam sejahtera kepada peserta. Terima kasih kepada ISM kerana menjemput saya sebagai penceramah pada pagi ini. Izinkan saya membentangkan pendidikan saya dalam bahasa Inggeris. Okay, so today I'll be sharing actually just my research on specifically exploring the interplay of social media, emotional literacy, and art in youth well-being. So these three studies are focused on youth, children, yeah? Okay, these are the three studies that I'll be sharing today. First one, social media on adolescents' mental health. Second is empowering youth through emotional literacy. And third is managing adolescent stress and building resiliency through mosaic art. Okay, now why we focus on youth? Why my team and I focus on youth? According to WHO, World Health Organization, suicide is the leading cause of death among young people worldwide. Yeah, and in the 2017 Malaysian National Health Morbidity Study, the rate of suicide among young people between ages 13 and 17 years old rose from 7.9% in 2012 to 11.2%. Now that's a big increase, yeah? About 424,000 children in Malaysia suffer from mental health, and studies have shown anxiety and stress directly affect children's mental well-being, leading them to be less interest in life activities, academic performance decreases, and it negatively influences other aspects of their life. So in the first study that I want to share with you is the impact of social media on adolescents' mental health. Now, this study was an interview based whereby we interview adolescents in the northern region of Malaysia. Now, Lenhard and his colleagues have identified that the age group between 13 and 17 years old are heavy users of social media in the US. Yeah. Now, 90% of children are at risk of being bullied according to DG CyberSafe. And 28% out of 6,795 young people in Malaysia claim to be victims of online bullying. Now, considering the widespread of use of social media among adolescents, it is crucial to explore the role of their mental health, taking into account both potential benefits and risks associated with its usage. Now, the methodology, we use in-depth interview, okay? In 2022, we interviewed adolescents. The interview took about 1 hour on average. Now, sampling-wise, we interviewed as many participants as we could until we reached saturation point, and we analyzed our data using Atlas T. It was a thematic analysis, yeah? So we recruited 41 participants. 17 of it are males and 24 are females. They were about, on average, 15 years old, okay? 35 Malays and 6 Chinese. And yeah. So the results, the emerging themes that we got from the interview were the importance of social media in addressing mental health, the effects of social media on one's mental health, and the coping strategies that the respondents use to deal with stress experience on social media. Now, the importance of social media in addressing mental health, there are a few importance. One, it enhances socialization. Two, it is the access of information. Third, entertainment. And fourth, respondents got educational resources from social media. Okay, this is the example of a quotation from the respondent. So here the respondent talk about how social media provides us with new information about the world, and this respondent used social media to update current affairs and gather information about the world, what's happening in the world. It alleviates her stress and serve as entertainment as well. Mm-hmm. So if you can see, these are sort of the things that pop out in our thematic analysis, whereby adolescents, the respondents are saying that social media has its benefits as well, the importance of social media to them, yeah? Now, what are the positive effects of social media on one's mental health? We gather that life is better with social media as it connects people with their friends, respondents with their friends, able to access information on the internet, a form of entertainment, as we've seen just now, and an avenue to express their feelings, yeah? Okay, the negative effects of social media on one's mental health: negative cyberbullying, internet addiction, bad influence of peers, yeah, a breakdown in family physical interaction, and misinformation. So if we can see, these are the examples from the respondents' interview. First here, you can see the respondent mentioned that there's a desire to imitate others, wanting to eat expensive food, buying expensive things, and then getting stressed because they don't know what they want to become. So this could be a bad influence also. And then misinformation here, presenting false news or distorted information. So one must be careful with the information received online. Okay, and then there's cyberbullying here. Okay, this person talk about cyberbullying, whereby teenagers take their own life because of it. And sometimes they can't talk, they feel sad, overwhelmed, and they can't talk to their parents about it, and they may resort to suicide. Okay, so this is one of the what do you call that? This is one of the negative parts of social media, yeah? Okay, coping strategies for dealing with stress experienced from social media. So respondents have mentioned their coping strategies. One is avoid social media and ignore the negative comments. They turn to trusted friends and family members to talk about their stress, yeah? And then they also turn to the spiritual aspect, which is praying, and they indulge in physical activities to get rid of stress related to social media. Now, as we can see, social media has its beneficial influences on adolescents, according to the findings. It includes facilitating social relationship, communication, fostering relationship, promoting social inclusion, and providing entertainment. And this is similar to other studies that they found this, similar things, yeah? However, prolonged engagement with social media platforms may lead to negative consequences for young users, as we see. Okay, spending over 3 hours a day on social media increases the risk of developing mental health issues, especially when internalizing your problems and not expressing it, yeah? Now, the second study is empowering Malaysian institutionalized children through emotional literacy. And this is an intervention, okay? Now, what is emotional literacy? Emotional literacy is the understanding of one's and others' emotional states and learning to manage one's emotions and to empathize with others, all right? And the higher emotional literacy you have, the better your well-being will be. Now, in this study, we aim to increase children's emotional literacy and psychological well-being through the implementation of an intervention. We recruited 67 children. We have 2 groups, one control group and one intervention group. We did pre and post evaluation of children's emotional literacy before the intervention and their psychological well-being before the intervention. And we measured the same thing after the intervention. Now, this is to see if there's any increase in emotional literacy and also their psychological well-being. The intervention consists of 8 sessions. One session lasted about 1 or 2 hours. And this was done weekly, so 1 session per week. Now, the topics covered in the sessions were managing emotions, expressing emotions. We talk about self-motivation. We talk about empathy, kindness, and also how to handle relationships with others. This could be relationship with your family, with friends, yeah? Now, how did we do this? It's through role-playing, drama, art, games, contests, question and answer sessions, and also dialogues, just discussion among group members. We aim for children about 9 or 10 years old to 13 years old. So we got the average age was about 11 years old, yeah? The findings showed that there is a positive effect of the intervention that we did on children's emotional literacy and psychological well-being. So there is an increase, okay? However, when compared between groups, between the control and the intervention group, there were no effect. Okay. What we can say from our findings is that enhanced emotional literacy enables children to recognize, understand, and regulate their emotion, fostering adaptive coping and reducing depression and anxiety risks. By integrating emotional literacy into Malaysian education, it actually empowers students to navigate emotion, build relationship, and excel academically and personality. Now, this is what we want to suggest to the Malaysian education system. Prioritizing emotional literacy, foster compassionate society valuing mental health and well-being. That's important. So emotional literacy, it is important in our daily life, yeah, and our well-being. Now, this is the third study, the last study that I want to share with you. It's reducing stress and building resiliency through mosaic art. So we're using art as a medium to reduce stress and build resiliency. And this study was done in a high school among children from 4 students. Okay. This study is actually my students' master's research, Lim Pei Fen, yeah? So credit goes to her for conducting the study. Now, the aim of this study was to investigate if there's any significant difference in the stress and resilience scores between the participants in the control group and the experimental group when they engage in mosaic art, from pre-test to post-test, and then we did a follow-up test. Okay. There were 30 students in the intervention group whereby they did the mosaic art, and then 30 in the control group. We also measured their stress and their resilience, their resiliency. There were 8 sessions, again, 1 hour per week. Post-test was collected right after the intervention finished, and 3 months after, we collected again data to see if indeed that their stress reduced and maintained at that level or reduced further. Okay, this is the demographics. We've got 12 in the control group and in the intervention group. So 12 male, 15 female, 11 males in the intervention group, and 19 females in the intervention group. Okay, so now results showed significantly lower stress and higher resilience level in the experimental group at post-test. So this indicates that mosaic art may be effective in reducing stress and increasing resilience among adolescents. So a little bit about the mosaic art intervention. Students were given recycled tiles. We collected tiles that were used, broken, and then give to the children to do, to break it into pieces. And then once they break it, they choose the pieces and form an artwork for themselves, whatever they want to do, a heart shape. There were also different like their names. They did their names. So, or some just piece the tiles together and make just a square, so piece them together. So a bit like Tetris. They did that, and then once they finished their artwork, they then explain why did they do that specific art. So this is where the expression of emotions come into play, whereby they talk to the researcher about their emotions and how they feel about their artwork and what are the process that they go through making that artwork. Okay, so in terms of reducing stress, mosaic art is considered a mindful activity, okay, where they just focus on doing the art, and it involves creativity as well. It's a safe and non-threatening way, non-threatening therapy, And mosaic art gets the person to look into introspective into their emotions. They are more self-aware, and it creates interpersonal connection between their friends. Yeah. Now, resilience, they perceive support, coping, and self-efficacy, and long-term session helps this resiliency, foster this resiliency. Yeah. Now, the limitation about this study is that the first 2 sessions was done on face-to-face, but after that, the 6 sessions were done online. Now, online, because it was during the pandemic, COVID-19 pandemic, and everything was, it was MCO that time. So this is actually, privacy issues could be one of the limitation. When students want to talk about their emotions, we do not know, their environment, whether their parents are around, or they cannot express themselves fully. Sometimes technological barriers may be a limitation as well, and lack of physical interaction with the material, and also restricted space for emotional expression, as I mentioned just now. Now, from these 3 studies, we gather that, we need to create more awareness about mental health and public education, okay? We need to reduce stigma towards mental health issues and its services, especially in our country. School-based intervention programs in reducing stress and increasing resiliency among adolescents should be implemented. We should also educate families and parents about benefits and risks of social media platforms and emotional resiliency. We should emphasize the importance of physical activity, adequate sleep, and time away from screens for children and adolescents, as this will help with their mental health well-being. And we should invest, lastly, we should invest in our adolescents as they are our future leaders. These are the references that I've referred to. I would like to thank, so the 3 studies were funded by grants. First study was funded by the TRGS Transdisciplinary Research Grant Scheme. The second study was a community engagement fund from Universiti Sains Malaysia. And then the third study is also the same funding as the first one from the TRGS grant, and also the community engagement funding from Universiti Sains Malaysia. And that's all for my talk, my sharing session. Thank you so much for listening till the end. Feel free to ask me any questions if you have. Thank you.
So thanks, Dr. Suzanna Bono. So we open up for question and answer session. We might welcome the participant to ask questions in the chat room, in the chat Q&A box, if any. Or later on, we just conclude with the, might as well, maybe they just, they need to listen and they mingle around. So how about if we go to the second panel? Dr. Azahah, are you ready? Dr.
Yes.
Azahah?
Encik
So
Jumaat.
I think later on after Dr. Azahah finish the presentation, so we conclude for the question and answer session. So I give the floor to Dr. Azahah. Thank you very much.
So first of all, thank you so much, Institute Sosial Malaysia, for inviting me to speak in this very interesting colloquium. And I also would like to thank Dr. Suzanna for sharing a three interesting studies related to youth, and also the use of mosaic art with adolescents. A very, very interesting study. So today, without further ado, let me share my screen. Okay, let's just give, if you can give me like 1 minute. Okay. Okay, I hope everybody can see the screen, right? Okay. Okay, Encik Jumaat, can you see the screen?
I can clearly see the screen, the reflection on social workers.
Okay. So,
Thank you.
again, Assalamualaikum and good morning. My name is Azahah Abu Hassan Shaari, and currently I'm a lecturer at Fakulti of Social Sciences and Humanities. So today I will share one of my interesting study that I conducted right before COVID, in 2020, right before COVID. As in my role as a forensic social worker in New York City. So I've been in New York City since 2011 until 2021. Okay, so this is one of interesting study because it's really close to my heart as a social worker. So the title of this study is a reflection on social workers providing services to people living with HIV, specifically in New York City. And why New York City? We'll discuss more about it later. And during its early discovery in the 1990s, which is probably 30 years ago. Okay, so this is one of the qualitative studies. So I will before I share more information about this study, if you have any question at all during this session, feel free to write it in the chat. I will try my best to answer it at the end of the session. Okay, and during this presentation, I am going to use both Malay language and Bahasa Melayu and also Bahasa Inggeris. Okay, so let me share you the introduction. Okay. So I will start my presentation by giving an overview on the statistic of HIV. So HIV was first discovered in the United States in late 1980s. So the first HIV that was reported in the United States was detected in San Francisco. Okay, so by mid 1980s, around 1985, studies reported that 2 to 3% of HIV cases in every 100,000 people in the US. So it's a pretty significant number. For every 100,000 person in the US, 2 to 3% of them living with HIV. Okay, by 1990s, so it was estimated that 200,000 cases of HIV in New York City itself. Okay, but eventually in 2020, the HIV cases among New York City people was significantly decreased to approximately 60,000. So it's a pretty huge and significant decrease. And why it decreased, we are going to discuss later. Okay. So in the 1990s, HIV case is a very severe in New York City. Okay. So next we are going to discuss about problem statement or why the study is important. Yeah. Okay. First, the study is important because during the late 1980s, when this disease first discovered, there are no research related to HIV. So at this time, HIV was known as GRID. So if you try to find any articles, medical articles, social science articles in the late 70s or early 80s, there are no articles that mention about HIV, but there are a lot of articles that mention about GRID, gay-related immunodeficiency disease, because medical researchers concluded that HIV or GRID, this disease was transmitted only via men having sex with men. So only transmitted among gay population. But eventually, they found out that this disease can transmitted to not only men having sex with men, but also mother to child, MTC transmission, blood transfusion, and also unprotected sex. So by the time, so they decided to change GRID to HIV. So this disease no longer related to, affiliated with one group, but it can be transmitted to all human. So they changed GRID to HIV. By that time, however, there are many patients left untreated, unfortunately. So there are women, there are children, there are people of color that been, living with HIV for quite some time, but the medical researchers cannot, provide support that they needed, Okay, so the second point why this topic is important, by the 1990s, okay, during this time, 200,000 cases of HIV reported in New York City. And these 200,000 cases actually represent the overall 20 cases of HIV in the United States. So can you imagine if we have 100 HIV cases in Malaysia, 20% of 20 cases were detected in Selangor. So it's a pretty significant number of people living with HIV at that time, okay? And finally, why this topic is very important, because even though social workers have been involved with providing services to marginalized population, including people living with HIV, but there are limited articles that explain about the roles during the period of early discovery. Okay. Okay, so next, in order for us to understand more about this topic, of course, we are going to discuss more about the literature review. So I divided this literature review section into two sections. The first literature review will explain more about studies that were conducted in 1990s. Okay, and the second part of this literature review will explain more about studies that were conducted from mid to 2000s to 2020. Okay. So the first section of this literature review focusing more on studies that have been conducted in 1990s. So according to this study, there are many studies in the 1990s focusing on examining HIV transmission among white gay male population. And according to this study, this population experiencing a lot of a very high level of psychosocial distress because HIV at that time were heavily stigmatized, okay, by the society. And during that time, due to the heavy stigma and discrimination experienced by this population, there are many self-help and volunteer programs that are organized by these gay communities to provide support that people living with HIV needed. Because at that time, society kind of like push these people away. Okay.
Dr. Azahah, if I may interrupt, your slide is not moving.
Oh, I'm sorry, Encik Jumat.
That's why as one of the participants is asking about the why the slide is not moving.
Oh, what about now?
I think better Doctor stop share screen and redo the share screen.
Okay, I'm so sorry about that. Okay, let me do it one more time, okay? Can you see the literature review section?
Yeah, definitely I can see.
Okay. Is it moving now, Cik Jumat?
Yeah, moving.
Okay,
Moving, but yeah.
Moving? Okay. Okay, I'm so sorry about the technical issues. Okay, and thank you for letting me know. Okay, the misconception. And during the 1990s, the misconception of the method of transmission of HIV, So at first, community medical researchers thought that HIV only can be transmitted among men having sex with men. So the misconception of mode of transmission resulted a very delayed response from the government, to address the psychosocial needs. Because at this time, the political leaders focusing more on family values, more on preserving the marriage. So at this time, society kind of like, oh wow, this is a disease that we shouldn't discuss openly in public, okay? And also, one of the important thing that happened in the 1990s is the establishment of Ryan White Care Act. Okay, Ryan White actually is a boy. He was a Jewish. I think at this time he's like 10 years old. So he received the HIV diagnosis not because of blood transfusion that he received due to because his parents is Jewish and he's Jewish, so his parents decided to have him circumcised. So during the circumcision, Ryan lost a lot of blood, and the hospital provide blood that was infected by HIV. So during this time, the community started to realize that HIV can be transmitted to not only to men having sex with men, but also mother to child. So people started to realize that, we need to provide more attention to this issue. Okay. And in the 1990s, the community, just like COVID, when we first experienced COVID in, I think, early 2020, community, we didn't know anything about COVID. A lot of people eventually, die because of this COVID. Medical didn't know what the safe precautions. So in the 1990s, the community experienced the same situation with HIV. We have this community, they didn't know anything about this virus. Okay. Okay, so next I am going to share the second section of the literature review, which is studies that mostly conducted in mid-2000s. Okay, so in the mid-2000s, there are a lot of studies that started to highlight the role of social workers in providing services to HIV/AIDS people. So I am not going to go too details about this literature review. So basically, each study shared that social workers play an important, crucial role in every level, in macro level, in micro level, providing psychosocial intervention, and in macro level, prevention and education, to advocate for the clients at this time. Okay. Okay. So next, I'm going to share about theory, use of political culture theory that will provide a lens for me to analyze the data. Okay, so basically there are three tenets of the political culture theory that can provide a better understanding of this topic. Okay, so three tenets. The first tenet says of political culture theory mentioned that society's attitude and values, our society's attitude and values will impact how people see the social issues. Okay, I'll give you one example. In Netherlands, society attitudes and values toward marijuana, society thinks that perceived marijuana is legal. So there is why if you go to Netherlands, you will find some bakeries will sell space cake that made by marijuana. Okay, but in certain community, including Malaysia, we didn't see marijuana is considered as illegal substance. So hence we will have different approach towards this substance. Okay, the same as prostitution. Sex workers in Thailand is considered as profession, but not in other country. So according to this theory, how we view the social issues based on how the society's attitude and values toward the issue. Okay. Second tenets in political culture theory is social problems constructed based on government involvement. Okay, how much effort that the government put towards to address that social problems. Okay, so that is the second tenet, and the third tenet of this theory mentioned that political process will influence the decisions in developing policy and outcomes of the social issues. Okay. This is more on technical part of the study, methodology. This is a qualitative qualitative study that using narrative inquiry. So narrative inquiry is a research design that provide that examine how people make sense of their own stories. Okay, how my participant in this study make sense of their own stories. In terms of sampling and recruitment, my social work professor, she suggested for me to contact these two participants that fulfill my eligibility criteria. These two participants, they are currently a social worker and also professors, and they started their social work profession, I think, when they were in the late 20s, mid-20s, and now they are in their 60s. And during the interview, they shared that this is the first time people ask them to reflect about their work. Okay. And the data collection, of course, qualitative, I am using face-to-face interview, semi-structured interview. And on average, the interview lasted 1 hour and a half. Okay. And the data was analyzed using phrases approach to analyze narrative inquiry. So there are 6 steps of analyze data using phrases approach. Okay. Okay. This is some of the questions that I asked during the interview. Of course, for a qualitative interview, the researcher itself is an instrument. I am so sorry. I just need to mute my phone for a second. But in qualitative research, the researcher is the research instrument, and the research question during the interview were asked based on what participants share. Okay, and for every study, of course, we have to preserve the rigor and trustworthiness. These are the 3 steps that I practiced, that I completed to make sure that this study is valid, and also not valid, to make sure that this study is trustworthiness. Okay, first, member checking. Right after the data analysis, right after the interview transcriptions, I email the teams, the quotes to participants, so both participants, and they are all agree that the quotes, the analysis is accurate. And after that, I invited my colleague who are also social workers working with people living with HIV to discuss about the quotes, the findings, and they also agree with the findings. Okay. Okay. So before I share more about the finding, let me provide an overview of the 2 participants. Okay, that are involved in this study. So both participants, they are social workers and also lecturers, and they started their social work practice in the early 1990s. As of now, as in 2020, both of them have been tulis a lot of books, a lot of journals, and one of them actually is a pioneer in establishing the first non-profit organization that provides services to HIV in the US. Okay, and the second participant, due to his active involvement to advocate for people living with HIV, actually he's been offered a professor to work at National University of Singapore, but he said due to his aging, he decided to decline the offer. Okay, so the findings. I am going to share more about findings, and this finding based on data analysis. There are 2 themes that emerge from the findings. So according to participant, social workers, they are involved in addressing stigma and discrimination that experienced by people living with HIV/AIDS at that time. Okay, because in the 1990s, due to misconception about the mode of transmission, a lot of clients, they were left untreated actually. Okay. And indeed, during 1990s, there is one medical breakthrough, which is the introduction of heart. Okay, but the introduction of heart also came with some psychological complexities. So before this, HIV is considered as a death sentence. So HIV is considered as fatal, you know. So, but after the introduction of heart, HIV shifted from fatal to chronic managed illness. But those who are taking heart, they will experience a lot of a very severe side effect. So social workers, they have to work with clients that are grieving. Many of them experience grieving and blame themselves because they lost their partners, they lost their close friends, they lost their family members due to HIV because heart is not there yet. But now they can live longer. So they feel guilty. Okay, they live longer, but they have to deal with this very severe side effect due to heart. Okay, and at this time, the social workers, they need to work with suicidal ideation, with stigma that community perceive toward their clients. Okay. And participants also share that in 1990s, there's urgent needs to provide various HIV, to provide services to address various HIV issues. So as a result, one of them decided to establish the first HIV organization, NPO, a non-profit organization provided services to HIV. Okay. Okay, so qualitative is all about providing voices to your participant. So I'll share you one of the quotes, okay? I'll give you like 10 seconds to read the quotes. One participant shared that one political leader approached him and asked if it's okay to tattoo patient with who have living with HIV, you know, to that point. So it's not only, so HIV during 1990s not only public health issues, but it's also a human issues, human rights issues. Okay. So the second theme that emerged from this finding is the role of social workers to advocate for better rights for people living with HIV. So according to participants, they play a very critical role to educate the community about how to work, how to live, how to live with people with living with HIV. Okay, so according to one participant, he was secretly brought to the hospital to teach doctors how to work with HIV patients. Okay, because at that time, so medical social workers, they are well known of their work working with cancer survivors and also tuberculosis TB patient. So that is why medical community decided to invite them, macam how to work with patient yang tak ada family members pun datang melawat, you know, how to work with patient yang ada suicidal ideation, yang sangat depressed. So diorang medical communities at this time they can treat the symptom, but they cannot treat the overall the psychosocial aspect of the patient. So sebab itulah social workers, they were invited, you know, to teach doctors how to treat patient better. Okay, and at this time participants share that they need to provide emotional, social, and practical support. You know, how to work with clients, how to work with client living with HIV when community rejected them. Okay, and during this time, both participants share that they decided to become innovative. So in order to educate the community about the right mode of transmission and about the human issues of HIV, they decided to create their own radio channel, television channel. So at the end of the broadcast, they will hug each other because they wanted to spread a message that, you know, you cannot get HIV if you hug people. You know, you cannot get HIV if you work with them. Okay, so that is one important role that they play. And they also become an advocates for people living with HIV by reframing the language. Instead of calling HIV victim or HIV sufferers, you know, if it's just very stigmatized, they decided to change the word, reframe the language to people living with HIV. Okay, so at this time, both participants share that they met approximately hundreds clients living with HIV. So they are not only their social workers, but they become their rabbi for Jewish. They become their priest for Christian. You know, right before their client pass away, either family members or client themselves will call these social workers like, can you come? Can you stay with me? Right, you know, be with me during my final hour, you know. So it's very it taking a lot of emotional toll for these two participants. And one of them lost a lot of weight. People thought he had HIV because he has to work non-stop to advocate the community and to be with the client, to be with the family members. And before heart, he lost a lot of clients that with HIV, and even until today, he shared that every time he passed the graveyard area, he can still, he can still remember all the memories that he have with each of them. Okay. Okay, these are some of the quotes that both participants share. Okay, so these are the two themes that were found after the data analysis: role of social workers to address stigma and discrimination, and also to advocate for a better rights. Okay, so this is going to be my last two slides. Based on the discussion, based on the interview, social workers social workers is basically agent of change because they create a better society that understand HIV better. Okay, social workers also involved with a lot of stigma reduction strategies and destigmatization efforts, including providing a cultural competency training to community. Okay, and currently, so HEART was introduced in 1980s. So in 2011, we have PrEP. PrEP can significantly reduce HIV transmission up to 92%. So right now, they are involved with to advocate community about PrEP, in order to reduce HIV transmission. PrEP client will need to take PrEP dose every day. So a lot of social workers right now, especially in hospital, involved with this counseling. Okay. Okay, this is going to be okay. Before I move to a conclusion, there is a lot of progress that has been achieved, in terms of advocate client with HIV. But we need more studies to examine the role of politician and funding. Okay. Okay. So this is going to be my last slide. Okay. A lot of progress have been made in terms of empowering and advocating people with HIV, but we have to remember that people living with HIV, they are still facing intersectionality of living in poverty, homelessness, and substance abuse. So there is a crucial need to train social workers, counselors, about how to work with this population. Okay, and for me, this is one of the study that highlight the legacy of social workers in providing psychosocial services to clients. Okay, so that is all my presentation. So thank you so much for listening. And if you have any question about the study or anything else, you can just contact me. Thank you so much.
Thank you very much, Dr. Azahah, because of, the presentation, nice presentation. I think we received various questions by the participants actually. Soalannya daripada yang ni dia tanya kepada kita punya ni lah, Dr. ni Suzanna yang mula-mula tadi tu. Dia tanya, peserta ni bertanya, kenapa sekarang ni remaja lah, especially sekarang ramai yang menghidap penyakit mental dan anxiety. Kenapa tadi? Dr. Suzanna?
Hai, jawab sekarang ya. Okay, there is so many reasons, actually factors for mental health, penyakit mental dengan anxiety at this age. One could be social media. Yeah, social media plays a role. Different factors in life. We're more exposed to the outside world through social media, and that gives us sometimes you overthink, overread information online that can give you anxiety. There's a study that I did that shows that during the pandemic, information from social media, information on the pandemic actually increases people's anxiety. Yeah, so that is one of the factors, but there are many other factors.
So soalan yang kedua dia bertanya tentang apakah strategi yang which is more convenience, berkesan untuk membantu this remaja untuk menguruskan tekanan daripada memikirkan masa depan dan harapan. Yelah, sekarang ni ramai ibu bapa yang memberi tekanan, yelah mereka nak selalu anak dia cemerlang dalam akademik dan sebagainya. Mungkin benda ni ada terkait dengan dan menyebabkan mereka ni indirectly affected with the mental health. I mean, which kind of the utmost punya strategi lah yang boleh kita pakai pada this condition yang sekarang, yang pertama sekali yang sekarang ada sehingga fluctuation ekonomi dan sebagainya yang boleh kita gunakan. Dr. Suzanna, or maybe Dr. Azahah boleh bagi.
I will try answer this. I know a lot of parents, they have high expectation on their children. One thing about being a parent, of course, this is you want the best for your children. You want your children to succeed. As a parent myself, I would like to see my children also succeed. So there is that expectation. Tapi as parents, we should understand that they have their own limitations. They have their own, standards that they can achieve. Some they cannot. So our expectation as parents, first we have to try to control and not put that pressure on our children. And as children, yes, although parents have that expectation on us, we try to do our best. That's all we can. As long as we do our best as children, work hard, study hard, and then achieve what we can, then that is good enough. Tekanan, there are many ways that we can cope with all this pressure. Of course, this pressure will give us stress, lots of stress. And from what I've presented just now, you can have emotion. You should try to learn how to regulate your emotions. So the emotions that you feel, make sure you're aware of those emotions. Once you're aware of those emotions, then you can regulate those emotions. There are different ways of regulating emotions. You have physical activities. You can nowadays people like doing art, painting, doodling, a sort of art therapy, doodling, journaling, bullet journaling. So there are many ways of coping with pressure through. One is through art. You learn about your emotions, being aware of them, regulate them. Yoga releases stress. Mindfulness is something that I am learning and trying to train people. Mindfulness. So different ways that we can uruskan tekanan. Now, it doesn't mean that everybody, because I suggested art therapy, right? It doesn't mean that everybody can do art. So certain ways of coping with pressure is different from person to person. Okay, so you need to find a way of that works for you. Okay, so this is trial and error. Keep trying. Okay, yeah.
Doktor, lagi satu soalan. I think this is the last. I mean, later on maybe there akan appear lagi another question in regards with mental health. But this participant asking Dr. Suzanna, I think he is asking how can individual maintain their mental. I think Dr. Suzanna indirectly dah jawab soalan ni. Cuma maybe can give another contoh lah. How can individual maintain their mental well-being while navigating the complexities of modern life? Because macam I tengok dekat dalam Facebook dan sebagainya, ada ibu bapa ataupun yang remaja kan, dia ada macam satu play yang dia boleh main macam game ke apa ke untuk reduce dia punya stress gitu kan. Mungkin di pihak Dr. Suzanna ada another situation dari segi gaming yang boleh ke apa ke, yang boleh kadang-kadang kreativiti tu boleh mematikan mental health tu sendiri.
Like I said, there are a few ways of reducing stress. One of it that's really important is self-care. Self-care. Now we are more aware of self-care. Now we talk about work-life balance, okay? And work-life balance, we don't focus, we have to have some time for ourselves and just focus on ourselves and forget about everything else. So self-care is important. So that's also one of the ways that we can, especially in this modern day, try to focus on our mental health. Like people back in the days, we don't talk about mental health, kan? Kesihatan mental. Like, we don't talk about mental health. It's a stigma. Kalau you say you're depressed, some parents still think, oh, sakit jiwa, something wrong with you, you know. And then if you want to go to the psychologist and seek professional help, people would say, oh, there's something wrong with you. You know, there is that stigma, that stigma yang, oh, this is bad. Now we have to break away from that and think that it's okay. It's okay to visit a psychologist to talk about your mental health, to talk about your problems. It's okay to seek professional help. So that is one thing that we have to be aware of. Okay, if life gets too stressful, take a break, step back, and reevaluate. Don't go right into it. Take a break. So that's self-care. So you have to be very aware. Now in mindfulness, we are in mindfulness. What I teach is the concept of mindfulness is being aware in the present time. In the present time. Now in the present time, you be aware of your bodily sensations and also your emotions and how that makes you feel when approaching something. You know, the question say complexities of modern life. You're talking about maybe, I'm not sure what complexities that you're referring to, but take for example, I'm giving you my own personal example. I've got work, I've got 2 kids, I've got house chores to do as a wife. So I've got so many roles, a lecturer, a mother, a wife, even a daughter. So I need to take care of my parents. That is just a lot already, a lot of responsibilities in life. But how we need to learn how to manage, take it slowly, and do what we can. Yeah. So self-care is very important now. Just being aware of yourself.
Another question, Doctor. Thank you for the answer. Now we're coming to second panel, Dr. Azahah. So the question coming from our participant, I think, considering the potential impact of HIV stigma on the mental health of adolescents, how can educational programs, especially and community support initiatives, be enhanced to promote resilience and well-being among this vulnerable population?
Okay, thank you so much for the question, Ch.Man, and also participants. So this is one of the important topic actually when we conducted a research among people, women living with HIV/AIDS in Malaysia. One of the common issue that they share with us, masalah anak mereka ada HIV dan it's very hard for them to educate the children about the status. One of the participant juga share, anak dia tengok drama dia pasal HIV and then anak dia nampak satu botol ubat yang macam dia kata, mama itu ubat yang ubat yang dia makan sama, dia ada HIV ke? So the participant share macam dia pun tak tahu macam mana nak cakap pada anak yang dia ada HIV. And another participant bagi tahu anak perempuan dia dekat sekolah setiap bulan kena pergi medical check up. Tapi dia takut untuk bagi tahu cikgu dekat sekolah yang medical check up tu untuk HIV. Sebab dia takut orang akan reject, you know. So one of the suggestion that we came up in order to increase the resilience among specifically adolescents yang ada HIV ni adalah untuk mereka mendapatkan macam yang Dr. Suzanna bagi tahu, mendapatkan perkhidmatan counselling profesional. Walaupun kadang-kadang it's not accessible to semua orang ya, perkhidmatan counselling profesional, sebab ada yang living socio-economic status yang tidak beberapa memuaskan, mereka perlu bayar kan. So but we try to advocate for the clients to seek help, to refer them to a very affordable mental health counselling services. Okay, and also at the same time kami sediakan modul untuk para guru bagi mereka memahami dengan lebih mendalam apa itu HIV, supaya sekiranya mereka mempunyai pelajar yang ada HIV, mereka tahu bagaimana untuk berkomunikasi. Dan sekarang dengan perkembangan PrEP ya, PrEP, HIV ini tidak akan mudah dijangkiti sekiranya mereka melakukan langkah-langkah pencegahan yang sesuai. In fact sekarang patient yang ada HIV, they can get married. They can definitely get married. Yeah. Dan another suggestion is for them to have their own peer support group lah. Tapi kita aware kan isu HIV ni also isu confidentiality. Kita as a practitioner tak boleh sewenang-wenangnya disclose okay support group ni untuk HIV. Okay, mungkin kita reframe support group tu untuk kesejahteraan minda adolescents, okay? Because ada sikit isu confidentiality. So peer support group, training for teachers and healthcare providers how to work with services, and also advocate them to seek affordable professional services.
Okay, doktor, kita ada satu lagi soalan. Yang ini dia tanya, maybe because now the forum is on Dr. Azahah. So, doktor, dia tanya, Doktor, could you elaborate on the specific psychological intervention or counselling approaches tailored for adolescents with HIV to manage, macam doktor bagi tahu tadi kan, to manage stigma, anxiety and depression?
Thank you again for the question. It's a very interesting question, just like the first one, kan? Okay, I really like Dr. Suzanna's suggestions on mindfulness-based intervention. Yeah, because a lot of people, a lot of Malaysian right now, they are experiencing mental health crisis, kan? So one of my suggestion is to seek mindfulness-based intervention, to make sure that the client itself can accept the HIV diagnosis, because HIV is no longer a death sentence now. People live longer even though they have HIV. It's a manageable disease. So with a good mindful based intervention, they can definitely increase their quality of life, and eventually that will affect their physique and also spiritual. Okay, and also for if there are another psychosocial intervention that I can suggest is cognitive behavioral therapy, because according to, and then we have we have DBT, dialectical behavioral therapy, but basically therapy such as cognitive based therapy ni dia akan bantu untuk client reframe the thoughts. Macam okay, participant bagi tahu dia takut nak share dekat anak dia pasal, even though anak dia ada HIV tapi dia tak tahu, takut nak share sebab dia takut anak dia terluka. So with the help of CBT, kita akan reframing balik kenapa rasa takut. Sebab rasa takut tu akan affect dia punya action. Sebab takut, so tak disclose. What if dia started to rasa this is comfortable, rasa rasa well equipped, rasa informed untuk disclose the status to her children, kan? So because eventually the children needs to know. In fact, another parent ada anak umur 17 tahun yang ada HIV, but she never disclose it. So bila anak nak pergi bekerja, dia tak mahu. Dia kata dia tak boleh lepas anak dia takut apa-apa jadi. So sekarang anak depressed. Why you never let me do anything? So with mindfulness itu, with cognitive behavioral therapy, dia akan bantu untuk klien reframe balik the thoughts. Okay, so that is two example lah yang saya boleh fikir sekarang.
Coming back to thank you, Dr. Azhar. Coming back to Dr. Suzanna, I have received the question from Mampu, Rosiana. She's asking about how do you determine the stress level of participants for the mosaic, I think mosaic, the tile art study?
Yes, I've seen the question. We actually use the DAS 21 scale that measures depression, anxiety, and stress, but we just extract the stress scores.
Okay, another question in regard to the HIV person. I think it has related from Dr. Azahah, I would like to ask, those days when these people, they encountered with people out there, they have a lot of stigmas, whereby they need to face, they need to encounter body shaming, indirectly shaming, what kind of shaming. But nowadays, they've changed totally, but still happen in rural area, in some places. So in doctor perspective, how this situation still happen in our society? I think I'm talking about in Malaysia itself. How what we call that, the visibility in terms of dia punya kesusah, dia punya what we call that, dia punya itulah, what we call that, dulu teruk sekarang tak teruk, macam tu. How in your, based on your presentation just now?
Okay, terima kasih Cik Jumaat atas soalan. So saya buat sedikit comparison ya. Kalau di United States, PrEP ya, use of PrEP untuk prevent HIV ni dia di-cover oleh insurance. So individu yang merancang untuk berkahwin dengan individu yang ada HIV, mereka boleh mendapatkan PrEP ni secara percuma yang di-cover oleh insurance. Tapi Cik Jumaat juga mention satu perkara yang penting yang berlaku di Malaysia ya, which is heavy stigma especially in rural area. Participant last year, tim saya interview participant yang berada di Terengganu. So betul, mereka memilih untuk mendapatkan rawatan di klinik yang sangat jauh dari tempat tinggal diorang. Sebab because kalau pergi klinik HIV, jumpa orang kampung kenapa pergi klinik ni? So she decided, I think 2 or 3 of them decided to receive treatment yang di klinik yang sangat jauh sebab takut orang kecam kan, especially women ya. So I think this happened because just like what political culture mentioned, social issues tu constructed based on how society perceive the issue. So sekarang kalau wanita yang dapat HIV, not all ya, majority akan ingat, oh, she is involved with hubungan seks rambang, ataupun dia adalah seorang yang tidak mempunyai moral yang bagus, sebab itulah dapat HIV. So some society yang still think like that. So sebab tu adalah still ada stigma tu. Ya. Yeah?
Coming back, thank you, Dr. Azahah. Coming back to Dr. Suzanna, this is beyond the question from the participants. Because the topic by Dr. Suzanna is more towards youth well-being. So nak tanyalah, kalau di sekolah lah, the syllabus nowadays, macam back those days, the syllabus, they thought about performance, how to achieve the merit. Kan sekarang ni, how dia punya condition in our educational system ni macam mana? I think maybe improve tu memang ada lah, tapi macam mana dari segi to cater this mental health among the youth, especially those yang I'm talking about macam budak-budak yang di sekolah menengah ni. Sebab mereka, because previously dia tak ada, dulu ada PMR, sekarang tak ada PMR. Jadi they need to learn semua tu dengan, macam doktor dah bagi tahu tadi, ibu bapa ni memberi tekanan yang tinggi untuk mereka dapat keputusan yang cemerlang. Jadi macam mana ni dari segi syllabus di sekolah, dan macam mana cikgu-cikgu handle kes-kes yang mental health melibatkan student lah, especially yang di sekolah menengah ni saya nampak.
Yeah, so in school we have lots of cases of suicide. Now, and also mental health problems, right? Issues. There are counselors in school that they can refer to. Tapi based on that study, the interviews that we did with the adolescents, they are actually high school students. They mentioned that they are scared to see counselors they are scared that their issues, the problems that they tell the counselors are not kept secret. So this is one issue that, you know, we should make sure that the counselors in school, they don't tell these stories to other students, you know, don't share these stories to other students. I think one thing that the ministry can look into is the counselors, train them, training, and also I think we are more aware of mental health these days, right? And so children are also, they're talking about mental health. Last time we never talked about mental health. We don't talk about depression. We don't talk about stress, you know. During my time in school, we don't use these words. But now children are more exposed because of the internet, right? They know more about all these mental health issues. And so that's just the first step of being aware, which is good, being aware, yeah. And teachers can help in the sense that they can equip themselves also in how to manage these students. So I think training-wise, teachers, training teachers and training the counselors in school to handle all these cases. That is important. Something that we can work on actually. So my goal is actually to impart all this knowledge to the youngsters. So I'm trying to get funding to go from places to places, especially institutionalized homes, because they are the most affected mental health wise. But yeah, things like this, you know, our effort into investing in our youth is important. So yeah, that's all I can say.
I think Dr. Suzanna and Dr. Azahah dah pun elaborate further on the topic mental health based on each of their research. How about if we have another 5 minutes? Can we conclude? I mean, we give this floor to Dr. Azahah first to conclude the presentation. Just a simple, just 1 or 2 minutes, and then to Dr. Suzanna before we end up the session.
Thank you so much, 𝐏𝐻𝐿. So as a conclusion, I do hope that participants can get some information about the role of social workers in providing psychosocial services to people living with HIV. Okay, and we can hopefully this knowledge can be transferred into practitioners who are currently dealing with people with mental health issues, and also, you know, people who experience post-COVID symptoms. Yeah. Okay, if you have any questions, do let me know. Do contact me at any time using my email or phone. Thank you.
Thank you very much, Dr. Azahah. And to Dr. Suzanna, your floor.
So based on what I've shared, all the studies, it's very important that we are aware about our mental health, and there are different ways to cope if we're feeling depressed, anxious, stressed. So find a way, a strategy, a coping strategy that works for you. Okay, it could be doing yoga, just being mindful, doing activities that can release stress, bullet journaling, many ways. So I hope that the attendees today, I'm sure you're very curious on how to cope with the stress. I'm sure you're feeling stressed if there are stresses in your life. I hope you can find a way to cope with that stress that works for you. And remember, self-care is very important. That's about it for me. Thank you.
So that is about it. We come to the end of the session. So pihak ISM merakamkan ucapan great attitude to terima kasih dan syabas kepada panel jemputan kita pada pagi ini. First, Dr. Suzanna binti Awang Bono, Pensyarah Kanan at the School of Social Sciences, Universiti Sains Malaysia. And our second panelist, Dr. Azahah binti Hassan Shaari, Fakulti of Social Sciences and Humanities, Universiti Kebangsaan Malaysia, di atas pembentangan dan perkongsian kertas pendidikan yang cukup menarik dan bermanfaat. Semoga pembentangan kedua-dua ini memberi satu nilai tambah kepada bidang pendidikan dan dari segi pembuatan dasar dan sebagainya. Tuan-tuan dan puan-puan, sebelum kita menangguhkan program kita pada hari ini, saya ingin memohon kepada semua tuan-tuan dan puan-puan untuk melaksanakan penilaian kursus atau program melalui pautan yang telah disediakan di ruangan chatbox aplikasi Zoom dan Facebook rasmi ISM. Selepas sahaja membuat penilaian, pihak kami akan mengumumkan email sejak kehadiran kepada tuan-tuan mengikut alamat yang telah didaftarkan pada mula-mula pendaftaran tadi. Sekali lagi Dr. Suzanna dan Dr. Azahah, saya mohon maaf bagi pihak ISM sekiranya terdapat sebarang glitch kesilapan sepanjang we conduct this program. Semoga kita berjumpa lagi. Assalamualaikum dan salam Malaysia Madani. Ilmu sejahterakan masyarakat.